ऊपर है आने अंकल देगा
नहीं है टू हाँ
इनकी तो पता हुआ नहीं है आप में आया नहीं टाइप થઈ ગયું
આ ફેરવવાનું કે છે 90 ડિગ્રી ના એનો વાંધો નહીં
Good afternoon, everyone. Now, assuming forward, it's my pleasure to introduce our next distinguished speaker, Dr. Abhijit Salunke. Dr. Abhijit, Cancer Research Institute, Ahmedabad. He has undergone extensive training, including fellowship at National University Hospital, MSKCC, New York, and Tata Memorial Hospital, Mumbai. As a visiting orthopedic on-call surgeon at multiple institutions, he has contributed significantly to orthopedic oncology, particularly in limb salvage procedures and rehabilitation. His innovations include multiple patents such as the iBone biosphere and specialized implants for various bones. With over 100 publications in index journal, Dr. Salunke continues to advance research and improve patient care in orthopedic oncology. Let's extend a warm and enthusiastic welcome to Dr. Abhijit Salunke.
So, respected teachers and friends, so in last 1 month I am here twice. So it's really great to be giving delivering talk at an engineering college. Maximum work what we do we present at a medical conferences. So this is different audience. So I can't teach you engineering that you are very much expert. So we can show how an engineer and doctor can collaborate. So in morning, the director sir said how we can improve the collaborations between medical and engineering field. So that is very important. We have multiple problems as a doctor, as a surgeon. So the solution can be given by you young people and engineers. So together we can collaborate on multiple projects. So at present we are having collaboration with Balera sir, Dr. Krupa madam and multiple professors here. So that can be extended in future. So this is the institute where I work. It's a government cancer hospital. In morning sir said that government institutes are having lack of facilities. So but I differ with that. We are having world class infrastructure. It is one of the best cancer centers in the globe. It's a 1,000-bedded cancer hospital. The gadgets, technology, what we use is at par or better than anyone in New York or any center in the world. So if you have a dedicated team, dedicated efforts, you can excel to any level. So these are my teachers in Mumbai Tata Cancer Hospital. So just we go to simple example like buying a shoes. Last time I showed this. So we want to buy a shoes, we go to a shop, see the product and buy it. But in future what can happen or in currently what we can do, just we scan our shoes, foot, get the size, design, change the color combinations, send it to your printer if you are having a printer of your foot printer, and it will print the shoes for you. So we are using here 3D printing, AR, VR and machine learning. So all technologies can be used. So similarly we are using for our bone tumors. If the person is having tumor in his shoulder bone, means scapula bone, the backbone. So we want to make an implant or a joint for him. We scan means we do CT scan, MRI, scan the size, mirror one size to other. So there are two shoulders. एक साइड का शोल्डर का इमेजिंग दूसरे साइड के शोल्डर पे we can superimpose, then segment it with the help of multiple softwares, then we print a model, then we print a joint, and that can be placed in the patient. So multiple things can be used in the technology. So you'll see augmented reality, virtual reality and 3D printing and machine learning also. So this is the simple algorithm how we process. First CT scan or MRI is done, 3D scanning, X-ray MRI, computer assisted model is made of that joint or surgery or anything. Then we do virtual surgical planning, do all the steps virtually. So before the original surgery we can plan all the steps, what problems, what complications can happen. So So like Mumbai Indian team and Gujarat Titans team. So Mumbai Indians is having an excellent bowler Bumrah. So Gujarat Titans can practice how he bowls, what can be the problems with him. So similarly in surgery also there are multiple steps. You want to dissect artery, vein and nerve. That are important structures. Artery is the structure which carries the blood vessels. खून ऊपर से नीचे लेके जाएगा. Nerves are the structures like electrical cables. So we need to protect them. So all steps can be anticipated before the day of the surgery, and you can plan the surgery. So that virtual surgical planning can be made. We can make implant guides or jigs. To cut the bone, we require multiple cutting guides or jigs. That can be made. And finally, the model can be made or the joint can be made, which is placed in the patient. So this can be done. So two simple examples. One is a small knee joint. So this is a small 3D printer what we have. We are printing a small knee model which is of 1 inch by 1 inch size. So you get the patient, you can explain him what can be the surgical steps. So if you explain in this way, the confidence of the patient will increase. That he is having a problem in his knee joint, the knee joint looks this way, and we will perform this surgery for him. So just it will take 15 minutes to print the knee model. It's very small, 1 inch by 1 inch. You don't have to pick big knee model. So similarly, you can print lungs, you can print mandible, any bone, liver, kidney, anything can be printed. Just you require the CT scan or the images, and you can print it. Secondly, Ram Mandir. Similarly, Ram Mandir, Bhagwan Ram, anything that can be printed. So we go to few case examples. So to understand what work we do or how engineering and medical collaboration is necessary or useful. So this is a tumor involving your ankle bone. The bone, this is your ankle joint. This is a foot bone. So this bone is having a tumor. We can appreciate this. This is a tumorous bone and this is the normal bone. So we get X-ray, MRI, CT scan of both the legs done. Mirror this part over this part. Then segment or design your implant model and then print it. So this is the tumor of the ankle bone. This is CT scan, MRI, CT scan. So like Rohit Sharma is having multiple treatment options, multiple bowlers. We can remove only a part of the tumor if it's benign. We can fix the ankle joint. We can 3D print it. So here we are used 3D printing in this case. So this is the ankle bone tumor model. This is your ankle joint, the leg bone. This is called tibia, this is called fibula, and this is called talus. जो पंजा ऊपर नीचे करते हैं अपन, जो नीचे का bone, रीढ़ी के part का bone. This is called talus. So we printed the bone. Then this is intraoperative surgical pictures. So we have applied the jig here or a model to cut the part of the normal bone so that we can put the artificial bone part. So this was a defect created after tumor removal. This is the base plate which was made up of titanium material. So medical implants are made up of titanium material or stainless steel or cobalt chromium. So multiple combinations can be used. Latest we are using PEEK material, polyether ether ketone. It's a carbon fiber material. Like Mr. India, it is not seen. So that is the latest thing what we are using. So commonly we are using titanium, steel or cobalt chromium. And this is the base plate which is placed. So if we can appreciate here, this is your tibia bone, this is the fibula bone, and this is the base plate. And these were the screws which are planned. So we have removed the tumor and this is the special ankle we have made it. So it is having three components. One is the talus bone. Second, this white material which is made of plastic-like material, which is high ultra-molecular weight polyethylene material like plastic, and again a metal. So it's a metal, plastic, metal component. Metal, plastic, metal component. You want to make it to glide. So these are the skin staplers we use. This is stapler लगाते हैं ना paper पे. Same type of staplers are used. Similar pattern. So we need to remove after 2 weeks. Inside whatever we put, that gets absorbed. This doesn't get absorbed. Again, some engineer must have devised this. So the collaboration thing what we are saying. So if we devise bioabsorbable staplers, you don't have to call the patient after 2 weeks. So you make a stapler or a material which just gets absorbed. So don't have to call the patient. If it's a kid, it's painful for him. Or for adults, it's still painful. But for kids, you make a bioobservable stapler that can be made in future. Currently, it's not there. And this is the radiogram. So we have replaced the talus bone and the upper part of the bone. So this is first follow-up of the patient. The skin was healing bit delayed. So you need to plan your case very properly. The size of the implant should be 15 to 20% smaller. So that we are learning last 10 years, 15 years, that should not be same. So otherwise the skin will not close. You can replace the bone, but skin, it's very tough to replace, skin or muscles. So it healed well. This was the 1 year and 2 years follow-up of the patient, implant setting very well. This is the latest follow-up of this patient. This is the function. He's at a limited ankle movement that you can appreciate as compared to another leg. He is going down the staircase. So other options would have been just fix the ankle. Here there is limited ankle movement at 3 years, but still there is ankle movement. This is the ankle movement, and this is the normal leg. Next we go to hand case. So again a customized implant was made and we can appreciate it's a honeycomb like pattern, lattice structure. So again 3D printing technology is used here. We made a special bone implant. We removed the tumor from here, and here again it's radial resolution means a plastic material, poly material. So this is metal, poly, and this surface is polished. So first we had made a solid implant. Then we had made a lattice structure. Then we again made the lattice structure more hollow so that the weight is decreased. We analyzed with finite element analysis. So any implant we are putting in the body, we need to make analysis that where it can break. So again, you require good engineer's help that to do finite element analysis with ANSYS software. So this is the case example. This is the tumor, fifth bone, first X-ray, second X-ray. This is opposite hand, normal. And this is the tumor bone. So the tumor increased in size, this bone was completely destroyed. There is no bone remnant here. It's just thin papery shell of bone. Again MRI done. So again multiple options. This is how we do planning. So this diagram was drawn by one of my fellows. So the radius bone, wrist bone. This is the metacarpal. We'll be removing it, and this is the 3D printed metacarpal will be placed. So you need to plan every case very properly. So planning for this case took around 1 month to manufacture the implant, get the implant. Everything took 1 month. So it requires very proper planning for your surgery also. So this is the design how we make the implant. So this is opposite hand. This is tumor hand. We'll mirror this part or this part. So we will remove this tumor. This is CT scan, MRI done. All segmentations and multiple softwares are used. One is Mimics and other softwares are there. So this is the tumor. We will be removing this tumor. This bone will be removed. And this is the implant which was intended to put. So first we thought that whole part will be metal. Then we thought that we make it more better. So this was plastic part made. Multiple holes were made which is multiple directions. So that you need to make the joint. उस हड्डी के आगे joint आने वाला है. You need to recreate the joint also. So these multiple holes were made in various directions. So this was the planning. So this is the implant, final implant which will be placed. This is the patient's clinical picture. We take all the X-rays intraoperatively. This was the tumor which was removed, and this is the metacarpal which was placed. And these are tendons. that needs to be saved. Here we have to create the joint. So we can appreciate the multiple holes in various directions. So here multiple tapes will be used to create the joint here. This is special material called PET material. So again, we need to import few things. We are not having these parts here. This joint was printed in India, but this cloth-like material is not available in India. So again, we have to take help from some another country or another people also. So this is like a socks, simple socks जैसा है, PET करके material है. So this was placed here. We recreated the joint, fixed it to the adjacent bone, and this was the immediate post-operative X-ray. So chances that this may get dislocated here. So in previous cases, this got dislocated. So we thought that we need to improve our cells. So do we fail? Yes, our cells also fail. So next case we have to improve it. So we made this joint more stable. We fixed this bone to this part, and it became very stable. So here we are not used staplers. It's a simple sutures. So again, this is not absorbable material. So this can be made in future, which is absorbable. So this was immediate post-operative follow-up X-ray, very much stable, didn't dislocate. This was clinical picture. So you can see a small video. So we can appreciate here, it's very stable. It's not dislocated. So again, this machine learning can be used, AI can be used to get the X-rays and other things. Machine learning can be used. This was the function. Next we go to shoulder bone, what I said, scapula bone. Again, it is 3D printed and we can again appreciate multiple holes to fix to the chest wall. This is the model. Here we have used augmented reality technology. So AR was used and VR is used. So HoloLens we have used. So it's like watching an Iron Man movie. So this is our operation theater. We use this. We record all our surgeries with action camera GoPro. So all surgeries are recorded with GoPro camera. So advantage of this is normally you need to see the X-ray MRI on a viewing box. So here we don't require. So this was the planning. This is a tumor which will be removed. So the scapula bone, shoulder blade here it is. So these are the HoloLens glasses. So you need to fit all the things what CT scan, MRI of the patient inside it. And I can visualize all these things in front of my eyes without touching it. So it's totally sterile environment. I don't touch any unsterile part. The CT scan MRI is in front of my eyes. I can superimpose that part over the patient's own bone. This is the chest wall bone. I don't have to print it. Previously we used to print this chest wall bone and other things. But advantage of this technology, we can superimpose one part of the other, like making a Google map of a surgery. So we know where the traffic signal is, where other problems are, and we can negotiate them. So this is how we can see the X-ray, MRI, CT scan in front of our eyes. This is the bone which will be replaced. The CT scans are in front of my eyes. I can scroll them up, down, zoom in, zoom out. All things can be run in front of your eyes. This is the bone which was placed. Augmented reality was used. And this is the final implant which was placed. So this is the tumor where it was involved. This is the MRI, CT scan. We can appreciate this is the tumor. So while removing the tumor, we don't see the tumor. That is important. केले जैसा है या एप्पल जैसे. तो केला उसका बाहर का कवरिंग, स्किन नॉर्मल स्किन, उसके बाहर प्लास्टिक कवरिंग. So tumor is removed in that margin, that model. You don't see the tumor. So tumor around its normal muscle, and with multiple layers it is removed. So then only the chances of it coming back again are decreased. So this was the tumor removed. This is the model of the tumor, and this is the implant what will be placed. So this was the implant which was placed. We can appreciate this is the bone, normal bone. We can appreciate this is nearly 15 to 20% small. So you need to calculate all the things. In due course of time, last 5 years we are doing this thing. So we have thought that 15% is okay, 20% is okay. What size is okay for the patient. So that again requires good engineering help. This is the thing which is used to fix the shoulder bone. This is like mesh, जाली जैसा है. Mosquito net आता ना, वैसा टाइप का ही है, but different material. This is artificial ligament, neo ligament. So we use multiple things in our surgery. So we are using titanium plate implant. We are using mesh, which is of polypropylene material. Then this is of PET material. And this is the closure. And this is how it looked on the X-ray. So next we go to 3D printed model and plate. So again planning, you get the CT scan, MRI done. This is the tumor and this was the plate which was planned. So which is of titanium material. So before surgery you can show to the patients and relatives this surgery we have performed. This is the bone, tumor bone. This is the tumor. This is the normal bone. And this plate we will be fixing here. It is made up of titanium material. We can see here few parts are solid and few are with holes. Here you can see few parts are solid. ऊपर नीचे holes है, बीच में solid है. So chances of breakage will be decreased. So you can counsel the patient's relatives that this surgery will be done. You practice all the steps a day before. Intraoperatively again you do all the steps and then perform the steps on the patient. This bone was dipped in liquid nitrogen. तवा आइसक्रीम खाया आपने? So similarly we dip the bone in liquid nitrogen for 20 minutes. 20 minutes in air and 20 minutes soil. So it will kill the tumor cells. That is the technology we use in this case. So here I have written particle liquid nitrogen, means without cutting the bone in one part, we dipped in the nitrogen. And this is the plate, just it is, you have to slide it. And this is the knee joint. एक आगे plate लगा है, एक side plate. And this is a neurovascular bundle, artery vein. So next we have seen AR, we'll see VR also. So VR, we use it for counseling our patients, training of our students. We have fellowship program at our hospital. So this is simple bone biopsy. Tomorrow Raghavendra sir will show this, how it is done by its latest technology. So we give for local anesthesia or general anesthesia is given. This is the tumor bone. So we first draw where the surgery will be planned. Like a screwing movement, हड्डी के अंदर needle is placed. We remove few tumor cells and send it to the pathologist. So they will tell it's tumor or not, or which type of tumor. So bit crude method, quite painful for the patient. जैसे दीवार में अपन खिला ठोकते हैं, just like a hammer and a nail we are putting into the bone. So very crude method, but practice all over the world. Simple method. So we thought that we will make a VR video of this same steps. So Oculus is used by Facebook Meta. First step is painting and draping, means clean it with betadine, give local anesthesia, then take the knife, give small incision, again same screwing movement, go into the bone, remove the tissue and send it to the pathologist. So we thought that we will make something newer device. So this is the traditional device which is used. This is the device which we got patented in 23, and it is using machine learning multiple sensors. So it is a distance sensors, depth sensor and pressure sensor. So role of sensors is here that it will go into the bone, it will know where it has to stop, where it has to come back, so it will get the tissue from the bone. And next we are working on a robotic arm. So that will be the next purpose. So this is our team. This is a small video of it, how it works. So you can preset the distance, 1 millimeter, 2 millimeter, whatever millimeters. It will go into the bone and come back again. So role of sensors is here. It has distance sensor, depth sensor, pressure sensors. Multiple sensors are applied. So it will stop automatically at the opposite cortex. Next. Just again, advantage of virtual planning. So in this case, femur bone or hip bone is there, and the neck was deformed. So this is not my case, but I helped a pediatric orthopedic surgeon to cut the bone very properly. So we made a 3D printed model. We printed a 3D printed jig. So he wanted to cut bone from here, here, and here. 3 cuts मारने थे both के अंदर. So it's very tough to do without any gadgets. So we thought that we'll make a jig or a cutting guide for him. So this was the cutting guide made, which will have 1 cut, 2nd cut, and 3rd cut. So it decreased the surgical time from 2 hours to half an hour. सारे steps एक दिन पहले करके रखे. So it was very perfect, very precise. He just applied the jig here, cut, take 1 cut, 2 cut, put the screws here. So this is the nail which was placed. So all things were planned very properly. So again, you require a good technology. This is the shoulder tumor surgery what I had showed. So this is the CT scan. This is the tumor. So this is the patient's position. This is biopsy scar. We have to remove this biopsy scar. And this is the virtual planning, how we do it. So this is the skin incisions, how we make it. So all things are very sterile, very clean environment is there in surgical. We do painting and draping, means all areas made sterile. The tumor will be removed. This is the bone model, which was planned. This bone will be removed. This is the bone which is removed. This is the shoulder bone, and this is the scapula bone. So we have cut what we had intended. So these are the borders. This is the tumor which is removed. Again, what I said, it should be very properly removed, otherwise it will come back again. So we again send it to the pathologist. They will check how much margins are there. There is a lot of machine learning and AI. So we are trying to work on principles of X-ray, MRI, CT scan, and this biopsy together. So their machine learning will be important. So this is the shoulder bone. We'll make multiple holes here. This is again a new bone which is made of titanium material. So we'll make hole into this bone. So it's like carpentry. Carpentry जैसा काम है. Same to same. So this is the drill what we use. Make hole. Fix this to this bone. Use multiple tapes. Fix this to the chest wall. Sutures are here. Rotate the skin, muscle, and close it. Similar to carpenter or a barber. Combination of both. So next we go to something new thing what we have made. This is peak material, polyether ether ketone. Like Mr. India, it is not seen. So whenever you get the CT scan MRI done, it can be seen on MRI but can't see on X-ray. So very useful new good material. We planned this design, made a holes here. So this was the tumor which was removed. This bone is placed. We can see here there is shoulder bone. यहाँ पे दिख रहा है bone. यहाँ पे we are unable to see the bone. So it is placed, but like Mr. India, it's not visible. So advantage is if you want to assess union means दो हड्डी जुड़ रही है कि नहीं जुड़ रही है, उसके ऊपर प्लेट रखी रहेगी, तो we can't assess that part. So it's very tough to assess union. So with advantage of this material, strength similar to bone, more strong than titanium, and still can be used. Next is bioabsorbable means which will get absorbed. So ऐसी हड्डी डालेंगे जो गल जाएगी पूरी 3 महीने 6 महीने में. So bioabsorbable. So it is made up of tricalcium phosphate material TCP. Again 3D printed. So we have put in 6 patients now. So you can use any new technology for your patient which can be useful. So we use PEEK, that is latest technology, and this is bioabsorbable. So are we able to print all the things? No, we are able to print bone because it's a dead part. Bone alive हो जाएगा. Other liver, kidney and other parts are still not possible. But in future, yes, it can be. So this is how the tumor was removed. We put a customized plate and here it was placed. Bioabsorbable scaffold. So this bone got united in 6 months time and very useful for the patient. Then sensors. So about sensors. So this is myoelectric hand. Just the next video I show. So this hand works on muscle stimulus. So you can see here, just I am touching the muscle sensor, this hand is closing and opening. This is the hand grip. Here are the sensors. So it's opening, closing. We can able to carry weight up to 3 to 5 kgs with this hand. So if the person's arm is cut from shoulder, elbow, above or below, or at the wrist, this can be used. This is myoelectric hand. Myo means muscle, again electricity. So there are muscle sensors. Just video is there actually. So this young girl's hand is cut from here because of tumor, and the sensors are attached to this part. So she is thinking from her brain that she wants to close her fingers. The signal from brain goes to muscle, from muscle to skin, and from skin this sensor will click it. So this gentleman's hand is cut from here, and this is the practice session. So it takes 1 month time. So this lady's hand is cut from here, and here are the sensors. So EMG sensors are there, muscle sensors. So she thinks from her brain, the signal goes to the muscles, from muscles to hand, and she is able to hold the objects. So this is the beauty of this hand, that you need to think from your brain, and sensors and signals can work to close the hand. So he's just thinking, and he wants to close his fingers. So just I'll show simple demo. So here are the sensors. So we can appreciate here, its hand is rotating. So that is one movement. This is the elbow, which will flex and extend. And third movement will be fingers. This is one hand, and I'll show the second hand. This is the second hand. So patient का हाथ यहाँ से कटा है. This part will be attached here. यहाँ से कटा है. So the shoulder is mechanical. Until in the whole world, no one has tried to make it mechanical, electrical shoulder. So we have electrical elbow, electric wrist, and electric hand. And here are the sensors. So one sensor will be touching this muscle, another muscle, and the person needs to get trained for this, using this. It takes time, but feasible for the patient. This is the bone biopsy gun, what I told. So this is the proof of concept, what it is ready. So it is having multiple distance parameters. So just press it, this part will move ahead and have two motions, forward and rotatory motions. So two motions. This is the bone. This is the femur bone or thigh bone. So the tumor is involving this part. From here you pierce it, go into this part, remove the tumor and send it to the pathologist. And lastly, to never give up in any of our surgeries, AI is pending. So we are working on this now for last 5-6 years. So we want to know Mr. Amrish Puri is benign or malignant. So there are two types of tumors. One is benign, second is malignant. So benign plan is different, malignant plan is different. So we need to draw, we have made simple methods, published 2 papers here, like borders. So India-Pakistan border on land. So just take a pen or pencil and draw the border. So if you are able to draw the border, it's most probably a benign bone tumor. So India-Pakistan border, Wagah and Atari. It's India-Pakistan, you can draw on a pen on paper. India-Sri Lanka border, C, we are unable to differentiate. Or India-Pakistan border on C. This is malignant bone tumor or bad bone tumor. We are unable to know where it starts and where it ends. So tough to know. So we are trying to make few apps or algorithms on this. That the surgeon makes the border and he can differentiate it's benign or malignant. We have published one of our paper on dental AI. So that is published. And we have made few scoring systems. So the score is less, it's most probably a benign bone tumor. Score is more, most probably a malignant bone. Just I will show the paper. So this is the X-ray. So we have titled it as A to Z RAM. So A is for age of the patient, B is for the bone, C is characteristic, D distribution, E exterior, F fracture and Z zone of fracture. So very easy to remember. A, B, C, D, E, F and Z. So how busy you are, you can just read the X-ray with this method. So we are trying to make an app of this. So someone can help us for making this app. So this is very well defined. Take a pen or pencil, draw the borders. So we are able to draw it. Second patient where again same A for age, B bone, C characteristic, D distribution. So this is malignant bone tumor where it starts very dense, we are able to differentiate. So this is one method what we used. And second, we made a scoring system. So we titled it as REST, Radiological Evaluation Score for Tumors. So here again machine learning works. So this is the thing. So we are given some marks here, 0 or 1. The score is less than 3, it's benign, more than 3 it's malignant. So again here you can use machine learning, AI to differentiate, get the score, take 1000 X-rays. So we are trying to annotate all the X-rays on MATLAB and other things. And then the computer will tell it's benign or malignant. So can we differentiate all the tumors? No, it has its own problem. So this was one of the X-ray where radiologically it looks benign, but it was a malignant bone tumor. So it's full sensitive. Yes, it is significantly sensitive, but still it has its own limitation. And lastly, one of my favorite surgeries, just to show how are the outcomes of this. So there is life with or without legs. We have seen life without hands. So this is life without legs. So one of our patient where the tumor is involving this bone, will cut it, only save the artery, vein and nerves, rotate the leg by 180 degree. Your ankle joint works like a new knee joint for the patient. So you attach it, पैर पूरा उल्टा रहेगा, ankle level will be same and there will be a shorter leg. So after this the patient has to wear a prosthesis, but still he functions very well. This is the fun patient. You can appreciate your ankle is totally reversed. Same thing we have done in upper limb also. We attach elbow to the shoulder. So when he wears this pant, it's difficult to differentiate what surgery was done for him. So this is called rotation plasty. Cosmetically not that great, but functionally it's excellent. And lastly, so we need to collaborate. So that is very important thing, that we need to collaborate with good doctors, good engineers, so that it can be beneficial to the society. And you fail or succeed, always inspire yourself and others. So you need to continually work on what you are interested. So that will be the take-home message from my side. So this is my email ID. Anything you can just email me. So thank you very much. So any queries, any questions? Yes, sir. You can ask.
Hello. Yes, sir. My name is Patan Kadam. So I wanted to ask that the implant that you did was a foreign material. So won't the body induce immune response against that
No.
implant? No.
There are chances that metal implant, some patient may have allergy. लाखों में एक में हो सकता है metal allergy. So that's why we are trying to use the newer material, PEEK. It is inert material. But rare or the rarest, some patient has any allergy of the metal. So it's titanium, very safe. It's practiced from last 30-40 years. It's nothing new. It's very safe for the patient. Rarely that patient may have allergy. Infection हो सकता है. So infection can happen with anything, but the body doesn't react to it. It's inert material.
And so, what's the particular reason behind keeping the transplant 15-20% smaller than the actual size?
Close नहीं होगा ना, skin close नहीं होगा ना. सिर्फ निकाल तो दिया, close भी तो करना है ना, बंद भी तो करना पड़ेगा ना. बंद कैसे होगा? तो बंद करने के लिए you require something. So you need to take muscles or skin from other part of the body. If you make it same size, close ही नहीं होगा ना. कहीं से और चमड़ी लेने के लगाना पड़ेगा. So that's why size was kept.
Okay. Thank you, sir.
Hello, sir. Remarkable work. Very much impressed. Sir, I just have two questions. First question is, like you showed the bioabsorbable. So, sir, I just want to know what is the reason why we use the absorbable one? Is it to guide?
Advantage of bioabsorbable material, you don't need to take artificial materials then.
But sir, as you said, it's 6 months.
It will get resolved. So you want to make the normal bone for the patient. At present, we are treating the bone with radiation, 50 degrees, or we are dipping in liquid nitrogen, or we can get the bone from bone bank. Bone bank आता है special, जैसे बैंक होता है ना अपना, पैसे का वैसा bone bank आता है, वहाँ से bone ला सकते हैं. In India, there is no bone bank where you get big bones. ऐसा पूरा हड्डी नहीं मिलेगा इंडिया में. So you need to import from somewhere else of a dead person, which will be size matched, and then it will be. So this is again dead part. So body takes it and slowly it revascularizes. So blood supply आएगा normal हो जाएगा. So you don't have to use these things. Just you 3D printed this big bone, यहाँ से यहाँ तक ऐसा 3D print कर ले, वो लगा दे, 6 महीने 1 साल में पूरा reabsorb हो जाएगा, और normal हड्डी बन जाएगी. So you don't have to remove it, and it's patient's own ultimately. Then you can put tissue cells inside it. At present, people have not tried it. So you can put cells, live cells डाल सकते हैं, make it alive.
यूजुअली जो भी इम्प्लांट्स होते हैं उनमें कोई शेल्फ लाइफ होता है कि फिर they can break.
गाड़ी का टायर जैसा है, बैटरी जैसा है. We explain same way. 3-5 years it may break. Depends on the activity of the person. But it lasts 10, 15, 20 years. It lasts.
Sir, last question. The metacarpal implant that you showed that it is lattice and hollow. Sir, you told that hollow तो वो उसका वजन कम करने के लिए.
वजन कम हो गया, lightweight हो गया.
Sir, why lattice?
हाँ?
Why lattice structure? The shapes and everything.
तो और कौन सा देख सकते हैं?
These are मतलब why it's not completely
solid.
हाँ.
So we had made solid also because weight was very big. weight वजन ज़्यादा था. हाथ में कोई चीज लगा के देखो तुम्हारे, कितना वजनदार लगेगा. तो अंदर जॉइंट डालना है ना. You make it more hollow, more lighter weight, and strength is same. So you compare it. So that's why I said finite element analysis, FE analysis was done to compare solid versus lattice versus more lattice. So we try to break it. Mechanically नहीं कर सकते break. We don't have a simulator for mechanical breakage, but on computer we can do analysis of that. So that was done.
Thank you.
Good afternoon, sir. So my question is related to the first case wherein the base ankle joint tumor was discussed by you. The steps involved in the bone measurement was that the alternate left or right, whichever is healthy, measurements are taken and it is imposed to the affected area.
Yes.
But unfortunately, if tumor is detected in both of the sides of the leg, then what
It is less likely that both the same part will be affected. And if it's two parts, then you will not do surgery for the patient. It's best supportive care. Bhagwan ke bas. So see, you need to plan your case very properly. You have resources. So we plan the cases that it is not spread to any other part of the body. So it is single part is involved. It is not spread to any other part. So we get PET scan or other imaging done. PET scan is a special test where you give glucose to the patient. So you give glucose, it goes into the body. And it goes area where glucose uptake is very high. So it will go to brain, it will go to liver and bladder. Any other part, it will glow on the computer. So it glows, then you will assume that it is spread to that part. it's spread to multiple parts, you will not do surgery for the patient. Then you just give chemotherapy or best supportive care. It's a single bone, then you will do surgery. Or if it's spread to so lungs, I don't do. Lungs, there is different surgeons, we will operate. But if it's spread to two bones, then you will not operate for the patient. You will not do surgery. The patient will die in 6 months, 1 year, if it's spread to two bones.
Good afternoon, sir. Sir, you talked about virtual reality and augmented reality surgeries. So, sir, I just wanted to ask which is like the better?
So both are different technologies. So VR, it can be used for teaching or training. So I want to show the steps of surgery to you or teach. It will be difficult to teach on a patient. Live aadmi pe I can't teach you. So I require a bone model, then the gun or needle, and I can teach on this. So we can have a workshop on bone biopsy here. Simple example. If I want to do a bone biopsy workshop for doctors or engineers to know what are the steps. So I'll get a bone model. These 10 models I will require, 10 needles I will require, और 10 लोग फिर 10 जगह कर पाएंगे. Then we can teach. We have virtual reality glasses. So one person is wearing the glasses. We can get the thing over a projector. VR glasses को प्रोजेक्टर से कनेक्ट कर दिया. तो एक आदमी स्टेप्स कर रहा है, बाकी 10 लोग प्रोजेक्टर पे देख रहे हैं. तो एक ही ग्लासेस से 10 लोग या 20 लोग सीख सकेंगे. Here you require physical 10 models, 10 all things. So very easy to teach and train. I want to explain to my patient. He will not be happy to do on this, but on VR he can do what are the steps of the surgery. So that can be used for training purpose. AR you can use for surgery. So someone is sitting here, means I am doing a surgery in Ahmedabad, and someone from New York or Australia wants to learn the surgery, or he wants to ask some questions or guide me if he is having something extra. Then all three can wear the glasses, HoloLens. He can be at same page in the surgery, and then we can do the surgery. So next we want to that we are sitting here. So Balera sir is sitting here, and we want to do a bone biopsy at my hospital. So it should be possible with the VR glasses here. Someone is standing there, AR glasses laga diya, and then the steps are done. So we can have tele-robotic surgery. So you understand tele-robotic भी हो सकता है. यहाँ glasses पहना सर ने और मैंने, और biopsy मेरे hospital में हो रही है. There is a robot and that can be done. So both are different technologies, totally different.
Also, sir, about the bioabsorbable materials, what kind of?
It's tricalcium phosphate, TCP material. Specific combinations are there, 18-20%. So it's available.
So as you listed about the X-ray images in the AR glasses, so is it a live feed or is it a priorly inserted image?
ये पहले insert किए. So live की जरूरत ही नहीं रहता है. Patient तो table पे अभी.
So वैसे
सबसे latest imaging है उसका.
बोन्स के अगर हमें इमेजिंग करना है उसी टाइम एट द पर्टिकुलर टाइम कि कहाँ पे कौन सा बोन लोकेटेड है या ऐसे कुछ तो हम कर सकते हैं.
हाँ कर सकते हैं. So we require trackers. So we are working on that. Trackers. So अभी serial जा रहा हूँ तो images getting distorted. So you require trackers now. So we are working on that. Trackers we are working. So we require lots of engineers.
Good afternoon, sir. Thank you so much for the insightful talk. I come from a background of life sciences, so I have a curiosity regarding that. So when we are placing implants in place of the bones, how drastically or how minimal effect it might have on the calcium homeostasis, sir?
It doesn't affect.
Doesn't it?
Doesn't affect. The implant doesn't affect your body, any other things. So you're replacing the bone with the bone. So calcium mechanism तुम्हारा आपका thyroid and other organs से चलेगा.
Okay, sir.
तो implants will not affect your calcium metabolism or anything. It doesn't affect. So there are few implants which may get corroded or leach. तो ये implant कुछ सालों में wear होने लग जाएगा. तो वहाँ पे locally it can affect, but it doesn't affect at other parts. So it may get leached. जैसे आपने टाइटेनियम मेटल का इम्प्लांट दिखा है, तो 10 साल 15 साल हो गए, it may get little bit weird. और वहीं पे वो particles deposit होंगे. In other जगह it rarely goes. So people have tried iodine coated implants. People have tried silver coated implants. So that can damage other parts, but less likely it affects them. And silver coating people have tried to decrease the infection risk. चांदी का कवरिंग लगा दिया तो it will decrease the infection risk, but it has its own problem. So people have stopped it. There are metal and metal implants which may get to other parts of the body. Metal and metal. लोग metal घिसने नहीं चाहिए. तो वो भी लोगों ने problem solve किया.
And another question that I had is, you told us about the bioabsorbable bone.
हाँ बोलो ऐसे सुने. बायोअब्जॉर्बल जहाँ पे आपको लग रहा है कि बोन को फास्ट यूनाइट करना है, हाँ यूनाइट करने के लिए, और यू वांट टू रिप्लेस द डिफेक्ट. सो वी आर यूजिंग, इफ इट्स अ किड ऑफ 5 इयर्स, 5 साल का बच्चा है, तो उसकी हड्डी का ट्यूमर निकाल दिया, तो उसकी जगह क्या डाल पाएंगे? वेरी टफ टू रिप्लेस. सो यू नीड टू गेट द बोन फ्रॉम मदर और फादर, दैट वी हैड एडेड. मदर या फादर का बोन लिया और वो बच्चे में डाल दिया. सो अगेन टफ ऑन द पेरेंट्स पार्ट. It is again dead bone. You can use this defect. तो defect fill हो जाएगा. बस कुछ करने की जरूरत नहीं. बोलिए. सब फ्री होता है मेरे हॉस्पिटल में, कभी भी आ जाए. कहीं का भी पेशेंट हो पूरे इंडिया का फ्री.
गुटखा बहुत खाते इसलिए पूछ रहे हैं.
मैं फ्री करते हैं, इसका तो यही कर देंगे. गुटखा खाते तो फ्री कर देंगे. फ्री कर देंगे, टेंशन नहीं होगा तो भी मैं करवा दूंगा. So all things are free for the patient. None of the patient has paid any single penny. This may be costing 5 lakhs, 6 lakhs. It should be free. बोलिए.
Sir, regarding the same bioabsorbable materials, what is your take on like including maybe pluripotent stem cells?
So that is the next thing. In future we can.
Okay, so you have not explored.
No one in the world has done.
No, there are a couple of professors or lab.
Humans में नहीं डाला. Humans में डाला
They are
था.
not implanted.
बैड डॉक्टर करके एक शो है, देखा? उसने ट्रकिया रिप्लेस किया था. बैड डॉक्टर है, गुड डॉक्टर कुछ है. मेरा नाम आ गया बैड डॉक्टर. उसने ट्रकिया रिप्लेस किया था. So he made a plastic trachea of 3D printing. And he said that he has added what she said, pluripotent cells. So there was no cells. It was just plastic trachea. And out of 10 patients, 8 or 9 died.
And sir, I wanted to ask, like, how well are these implants going to act as a scaffold? Basically, if we can mimic, we can use these structures as a bridge, basically, and grow cells on them and like replicate those bone structures.
Bone का advantage is dead bone also becomes alive.
Okay.
So in bone you don't put any cells also, it is good for it.
Okay.
So bone is a structure which is very flexible part. So you just connect the two ends, and one alive end puts cells into the dead end and it regrows. That is advantage. So less likely you will put any cells also. In future you can put.
Yes, sir. Thank you.
Sir, bad doctor मैंने बोला ना, शो देखिए. क्या होगा?
Sir, as you give us light on the experience of your let's say the advantages of the technology you used. So, of what was the disadvantages according to your experience? Is
Of
there
using
any-
technology.
Yeah.
It takes time to plan a case. So it significantly takes your time. So if you plan one case, it takes lots of time. You want to put a new joint, it takes time. New implant, it takes time. So for few implants, it had taken 3 months also. So for 3 months, I didn't do the surgery for the patient. It was benign bone tumor. I gave some chemotherapy. It was in control. And then we designed the implant, and planned the implant. It was perfect. And then only we had put into the patient. That time it may take. It may fail. Yes, it has failed in few cases. But ultimately, you need to do the work, and then only you can fail. And then only you can improve. So the metacarpal example I said, In first metacarpal it got dislocated. So second and third it was perfectly precise. So you learn from your mistakes. No one has prepared a metacarpal in the world. So we're the first. So ultimately there are chances that you may fail. So time, second cost. So it's mine is a government cancer hospital. I get funding from government or some NGO. Or someone I get it. Patient doesn't pay anything. So if it's in a private hospital, this surgeries may cost 5, 10 lakhs, 15 lakhs, 20 lakhs. So cost will be problem. So conventional methods can be used. So what I said, conventional method is यहाँ पे हमने पैर की हड्डी लगा दी, फील्ड रख. We have put it, yes, we have put it. दूसरे पैर की फुट की हड्डी यहाँ की, फुट की हड्डी यहाँ पे लगाई. So we have put it, yes, we have put it. So we have gone through all the phases of evolution. So we started with, जैसे मैंने कहा कि मदर की हड्डी या फादर की हड्डी. So we have put it into the patient. Technology has its own problem, cost, time, but you need to evolve with time.
Thank you so much.
So instead of using metals and all, why can't we directly use the 3D printer?
वही तो ट्राई कर रहे हैं.
Okay.
But it has its limitation. 3 महीने में खत्म हो जाएगा, पूरा एब्जॉर्ब हो जाएगा ना. So something you require for lifelong.
So the bone cells are already dead, right? So.
हाँ तो डेड वो अलाइव हो जाता है. अलाइव हो जाता है.
So also one more question. So you said that there are chances of dislocation. So that's why you use a PET material. So what about the floating bones in the rib cage? They are broken or if you want to reach.
Generally for ribs we require plates. Rib का bone टूटता है तो छोटी plates आती है, वो लगा सकते हैं. Again the bones are very thin. Plates again break. Screws can break. So in ribs or a few bones you don't require any surgery. Clavicle bone you don't do any surgery. Ribs bone it's single ribs you don't do any surgery. It heal on its own. Bone का ये specialty की टूट जाए तो भी अपने आप heal हो जाता है.
Thank you.
This all is for tumors. This can be extrapolated to other parts, but all work was for bone tumors.
Okay. Thank you.
Hello sir, my name is Viren and I am doing some early research in terms of like pro-diagnosis or early stage detection. Most of your work where you have used this ML algorithms is mostly on the after the thing is diagnosed, right? So how you have described one such case where it was misclassified in case of benign and malignant. So similarly, in the early detection or wherever we use radiology reports for the prediction. So there are a lot of false cases as well. So how do you convince a healthcare professional or a facility to implement such systems or start a research for them?
So this is not to replace the doctor.
Yeah.
It is aid to the doctor.
Yes.
तो समझो आप ओपीडी में बैठे हो, आपने एक्सरे पे क्लिक किया, आपको क्लिनिकली लग रहा है बेनाइन है, एक्सरे पे बेनाइन लग रहा है, एमआरआई पे बेनाइन लग रहा है, so most probably it's benign. Ultimately biopsy will be the gold standard. So for pre-diagnosis of any cancer, so like oral cancer you can say, not for bone tumors. Bone tumors is 1% of all tumors. It's very rare. So it can be used for oral cancer. That you click the picture, oral cavity का picture ले लिया, and 1000 picture ले लिए. You compare it is a tumor or not. So there it can be useful, but it is not to replace the system. So again, it's always clinical.
Sir, yes, your point is correct, but like a lot of healthcare professionals understand this as a like they are not very
Skeptical.
ready or
They
they found
because
it very skeptical.
It is not time tested everything. So you require lots and lots of data.
Yes.
Thousands, lakhs of data, X-ray, MRI लगेंगे. Then you can predict the value. So to gain the confidence, you have to show your results. Then.
Right, sir. Thank you.
Thank you, sir.
Thank you for that insightful session. As we conclude this session, let us take a moment to express our gratitude to our distinguished speaker for their valuable time and knowledge. I would now like to request Dr. Rahul Kumar to kindly present a token of appreciation.
Thank you, sir.
my privilege to introduce our next speaker, Dr. Santosh Satapathy. Dr. Santosh Kumar Satapathy is currently a esteemed researcher and academician with PhD in Computer Science and Engineering from Pondicherry University. He has authored over 100 research articles in reputed Scopus SCIE, SCI Index journals and conferences. Recognized for his contribution, he has received prestigious funding grants from DST, NIMH, ANRF, AICTE, and Ministry of Education, various research programs. Dr. Satapathy has been honored with the Best Paper Award at AIC 2020, Mind 2020, IIT MSI 2024. His research expertise spans biomedical signal processing, brain-human interface, EEG, data analytics, computer vision, image processing, pattern recognition, artificial intelligence, and machine learning. He is also an active reviewer for leading journals such as Scientific Reports, Elsevier, and Oxford University Press, and holds membership in IEEE, SCRS, and IAASAAC. Let's extend a warm and enthusiastic welcome to Dr. Satapathy.
Okay, meantime we are having discussed with some few points here. So first of all, I am thankful to both the coordinators, Dr. Manish Sharma sir and Dr. Rahul Sawan sir, for inviting me as one of the speakers for this national workshop. And the title of this workshop is also quite more interesting. So here we are using the two very good known words in common days: artificial intelligence and sensor technology. So now these two things are most quite useful in every interdisciplinary applications. So just now we have a very good talk by one of the speaker of this FDP. He is in professional in doctor and I am in professional in engineering. So both domains are different and both expertise are different, but our goal is same. Doctor goal is going to be also EEG diagnosis, early diagnosis, and patient comfortable and patient more comfortable towards healthcare with proper infrastructure. Our goal is also same as engineering. We have to provide also our best infrastructure with the help of AI to make decision making early as soon as possible, as early as possible. And we are going to help you to take a decision in terms of data. And we have to help to clinicians to take more elaborately to discuss the features of the disease. All these things are going to be the common for with respect to doctor and with respect to engineer. So the title of this FDP going to be suitable for the doctor and engineer. So the title is what? Innovation Healthcare Infrastructure. See, whenever we have to discuss about the past story era of 2000 and 90s with health infrastructure in India, in the present scenario of health infrastructure in India is going to be quite a huge reflection with respect to diagnosis, with respect to monitoring, with respect to treatment. So as a doctor, as earlier talked, he has shown some artificial devices. So whenever he has reflected some artificial devices, you are also very astonishing or surprising that everything is possible. Yes, everything is possible by connection, by connecting, by managing, and by taking some decisions. So if one hand is going to be due to some accident or due to some infection or due to XYZ reason, there must be not going to be effectively working, we have to replace it. Yes, we have to replace it. If similar way there is, if any limb or any leg or anything you have to going to be defect with respect to any type of internal infection or external infection or either any type of disease, we are going to replace. But till now we are not going to replace our one of the main important or central part or central repository of a subject, that is called as a brain. So till now we are discussing upon artificial brain. ChatGPT, we have to sometimes we have to discuss about what artificial brain. So whatever you can put some question, artificial brain gives some correct answer. Either it should be 70% correct with respect to your question, 60% or maybe 80%. So more accuracy we are going to be trying with a different type of version of ChatGPT. And different similar AI models also you have to witness it to get more correct answer. But in my presentation, basically I am discussing upon AI-driven brain-computer interface. Sir have mentioned that sensor technology. Yes, sensor technology gives you real information from the environment, going to be perception of that information, and accordingly we have to react to those information, and accordingly we have to take decisions. See, for example, if I am asking about you one question related to your date of birth, so what's your response of seconds? Within 2 seconds we have to go for response. So if you have discussed about some basic information asked from your brain, it will be depend upon your weightage, depend upon your neural activity, you are getting the answer. But how we have to analyze the brain behavior? Because every individual is having individual brain behavior. For example, if I have so rather than slides, I am going to be interact with more with students, and after that my students come from here to discuss about some live demonstration with some coding. So if I am going to ask you about your date of birth.
71200.
So what is the addition between 3 plus 5?
8.
What is the addition between 33 plus 53? 33 plus 53. See, the difference between response of answer. See, whenever I just put the answer question of 3 plus 5, a quick response from the one student. But whenever the same addition question I am asking 33 plus 53, 2-digit mathematical going to be asked here, so the question of answer will be little bit delayed. She know the answer, but takes some time to computation between the 2-digit addition, and it should be somehow processing time should be more. Similarly, if I am going to be asked you the first teacher of your education career, see, maybe more than 5 minutes, 10 minutes, he should rethink about the first teacher of his education career. So why should we remember only the date of birth? Why should we remember our appointment date in first job, or either we have two parents' name or some relatives' names? Why not other things we can going to be memorized for long times? So that should be the one of the important concept of brain behavior analysis with the help of AI. So in present scenario, you know that NFSU student, any NFSU student here as a participant? So the job of NFSU is what? Forensic investigation. So what is the major investigation there? To go for crime investigation. They go for what? So many crime investigations with the help of analysis. So one of the analysis was brain mapping. So whenever they have go for brain mapping, what they have analysis? They have analysis with brain behavior. So how we have to going to be analysis of brain behavior? If anyone can tell sir, simply he is very depressed and he is under stress. So how we can assumption that that subject is going to be caught as a mental illness? So we have to take advantage of AI techniques, artificial techniques, and sensor technology. With the help of that, we have to analyze the brain behavior. So brain behavior analysis is the most complicated things which is going to be in present challenges to decide either the subject is going to be maintain mental wellness or not. So many times we have to discuss. Our PM Narendra Modi is also going to focus upon Atmanirbhar, Sust Bharat and Swasth Bharat, and Atmanirbhar health Ayushman scheme, and under that we have to only thinking upon mental health. So how we have to maintain our mental health with health? So what is the meaning of innovation? Anyone can? Innovation?
Anything new invention or something?
Yes. And infrastructure?
So basically the things we need or the apparatus we need to do something.
So something we have to be come into the picture in terms of healthcare, and we have to use some technology and to enhance the improvement or maintain the accuracy with respect to some challenges diseases. So in most of the times in Gujarat, Ahmedabad and Gandhinagar, we have to initial days means 5 years, 6 years back, dengue is one of the diseases. And most of the times August to October, we have to suffer a lot with help of dengue disease. So now, what is the chances of death ratio chances in dengue in comparison to initial 4 years back? The ratio is very less. Now the dengue is going to be treated easier way by going to be under diagnosis or under treatment of 1 week or 2 weeks. If it is critical, 2 weeks. If it is medium, moderate with respect to the health, then we go for 1 week, that person is going to be purified. So with better infrastructure. Similarly, we have cancer treatment. We have, as mentioned, a lot of things is going to be replaced in our body with help of sensor technology. But those sensor technology we are going to be monitored from brain. See, for example, there is something there in insect, very dangerous insect is near to my position. So whenever my visualization is going to be impact with that dangerous thing, what is my movement? What sensor is going to be direct to me? Sensor, my brain is going to be direct to me, either move back 2 steps, or there should be call, help me, or there should be call to protect myself with the help of to another way. So anything is going to be direction from my brain itself. So the brain infrastructure is most important to monitorize the sensor. So how our sensor is going to be activated with help of brain response. If everything is okay, for example, one subject is 6 feet height, good muscle power, good physical health, but brain is not going to be work. So what is the impact of that subject? Nothing to be decided. If one subject is very good health, everything is good, physical by condition, everything biological condition is good, but his mental behavior is not good. Tell me, either the subject is going to be fruitful dealing with any job? No. Why? See, if your hand is not working, duplicate or machinery, electrical, whatever the thing you can replace. Okay. If your leg is not working, you can replace. But everything is replaced. But if your brain is not working, how you can go for it? If the analysis, if the subject is having some neurological disorder, then what kind of infrastructure we are going to use it? What type of innovation things we can going to use it to decide or to monitor the subject's behavior? So if a subject having less visualization power, which device you are using? How you can improve your visualization? See, you are having short distance visualization problem and long distance visualization problem. So what type of going to be you are using so that you are improve in your visualization power?
Specs.
So with help of specs, we have to improve our original visualization quality. So in that replace we are using specs. So similarly, what type of things we can go for use it, or what type of things we can maintain in our daily life, so that we have to going to be tell it is a mental wellness is good and quality of life is good. Anything? She like how she mentioned spectacles is going to use it for this. Some, if leg is not working, some artificial legs we have to going to use it. If there is something problem with our different physical portion of body, we are going to use different artificial devices. Those artificial devices should be controlled by brain itself. So brain pass some signals, and those signals only going to be automate those devices. See, if I am going to tell you to walk, so what, your brain receive my signal and respond my voice or anything instruction, accordingly you have to react. Means your brain first receive the signal information and then you can react it. So similarly, we have to be so many neurological disorders we have, like one of that disorder is sleep disorder, and you know that sleep symptoms and sleep psychology is important for our life, and 1/3 of our life is consumed as a sleep time. And whenever we can think about sleep and sleep characteristics, we have to importantly know that what is our sleep cycle. So the sleep cycle for different age group is going to be different. For example, childhood, the different sleep pattern. For example, newborn baby going to be sleep 18 hours, maybe 19 hours. Their sleep pattern is quite different with our adult sleep patterns. So we have to take 6 to 8 hours good sleep as per the sleep standards. We have to requirement of 6.5 to 8 hours of good sleep pattern to be maintained. So how we have to going to be monitoring those sleep disturbances. So if you can tell that, sir, I have not get a proper sleep in yesterday. So how should we have to going to be analysis with help of technology? Which technology? AI and sensor technology. So how we are using different sensors with our leg, with our different type of hand movement or different type of motor movement. So similarly, we have to use also some sensors with respect to the measuring the brain behavior. So those electrodes we have to going to be put on skull, and we have to maintain the signal behavior. So before going to be depth of my topics, I have to go for it the basic information of brain structure and function. Just yes. See, if the human brain were so simple that we could understand it, we would be so simple that we could not. See, if anyone think the human brain is very simple infrastructure, because you are use the word infrastructure. See, I am come to the topic as per your theme of your national workshop. See, we have innovation. Yes, we have very good innovation with respect to different healthcare. Today we are going to be approachable to diagnosis of cancer-like disease. Today we have approachable to different neurological disorders. Today we have to going to be replacement of heart surgery and other things. A very good infrastructure with respect to medical science. And we have the thing of sensor technology and AI. So what is the role of AI? See, as sir mentioned, doctor, till now there is no any device like that to completely replacement of doctor. So it will be help and assist to the decision process. So if see, a doctor is 35 years experience, 50 years of experience, one doctor. Whenever you can go through some discussion with one disease, what is the first response from doctor? After taking list out from your side, doctor mentioned that go for this test, X test, Y test, Z test. Why doctor mentioned only the test, X test, Y test, Z test? Doctor have already habituated with similar symptoms, patients, similar types of patients in the career, 10 to 12, 15 years of careers, they deal with different type of subjects, behavior and disease behavior, all these things. But even though they are having 15, 20 years experience, why they have first option go for test? The test is going to be help to decide more good diagnosis and more good treatment. So we have, don't think about the brain is a very simple. Brain is having also so many complications in their behavior. So we have to analysis with help of the techniques like AI and sensor technology. Let's come to that. See, this is the part of brain. So I am not going to be more depth because the slides are more content and our students also going to be live demo, so that I am not going to become from theory to a practical time. So we have, this is the structure of the brain. Next. So this is the another brain stem, and medulla is different parts of our body which is going to be react or which is going to be responsible how our brain is functioning. See, brain behavior is very quite not going to be analysis suddenly. If you are very silent, see, several times as a teacher, we are not going to be identifying either the student is a good student or average student or below average student. If one student in the last bench, very calm and quiet, and without any reaction, he or she is going to be observing the classroom, maintaining his or her daily class activities, and we feel that the student is a very poor student. But whenever the exam results published or whenever the exams result notified, we found the students are good. So to understand the student performance, we have to wait 3 to 4 months till the exam, final exam answer sheet to be checked from the evaluation process or by the teacher. So we have to require all the brain is so completion and very sensitive, and we have to care of our brain and the parts so that we have maintain a very good mental wellness. Next. So these are also similar terms of different type of brain behavioral, what are the things it functions in sleep and arousals of sleep. So the main topic of my talk is sleep and sleep stage classification and how it will be benefit for to identify some disorder like sleep. So there are several disorders like sleep apnea, insomnia, parasomnia, periodically movement disorder. All these disorders are commonly found in India as a sleep related disorders. See, now no one can maintain a proper sleep. We have a proper sleep is what 10 p.m. go for bed. Early 6 a.m. we should go for wake, and after that we have to complete our daily life routines, and then after we go for school and college. But nowadays, I am very sure that most of the young age students like you, they have go for sleep after 2 a.m. or 3 a.m. by influencing of social media, influencing of social gadgets, and all the things going to be later on going to be disturbance in your social peacefulness and social quality of life is going to be disturbed. We are not going to be rest our brain. We are not going to rest of our body. We are not going to be rest of our brain. So whenever your brain is not going to be proper rest, then a lot of things is going to be coming to the later on reflect on this. See, there is some statistics in medical sciences in COVID, post-COVID and pre-COVID and during COVID. If one patient is going to be identified as COVID positive, he is or she is under stress. What is the stress? The stress is either, am I recover from the COVID or not? The one question, shall I recover from the COVID or not? That is the only one question from every mind. Means mind is stress. Mind, see, several times we are talking about, sir, his mind is not intelligent. His mind means what? There is what mind. Several times we are discussing mind. But whenever we have to think upon the mind is not working, sir, his mind is not working, like several times in our friend circle we have to discuss with ourselves. But mind is not working means your brain function is not proper functioning. So how the brain is proper functioning? If you have to maintain proper sleep psychology. So sleep psychology is a process where you have to maintain, then your brain activity is daily going to maintain discipline way. Next. This is the cerebellum part. Next. This is the different segments of our brain part. Next. So these are the different brain structure and brain behavior in the first phase of my slide. Next. So next. This is the cerebral cortex. All of you know some basic information about brain and brain segment. Is all of you know, but just little bit I am going to keep it the slide so that you have to refresh your some information so that we will discuss the next phase of slide is more easier way. Next. This is the important part. So, see, we have frontal part of our brain, central part of brain, parietal part of brain, occipital part of brain, and temporal part of brain. Every lobe, every section have its own responsibility. For example, if your temporal lobe is not proper functioning, see, in among yourself, one can read one text before exam. He or she very good way capture all the information. One can read 20 times. Even also he or she is not going to be properly write the answer. One can read 5 times, partially correct the answer. See, instructor is same, subject teacher is same, university same, study material same, everything same. Even also we have write different answer. Why? Can anyone analysis? See, the subject teacher deliver the same concept to all the 60 students. Same material, same PPT, same material is going to be shared to all the 60 students. But whenever we have go for your check your answer sheet, we have received different answers from different individuals. What is perception behind this? Because our brain behavior of individual one to individual one is different. So our capturing power is different, receiving power is different, or according to receiving, answering or representation is also different. So one can quickly represent, one can medium pace going to be represented and slowly represent, and another one can still not going to be properly write it. See, whenever we can interact with some students, Bhaivan, sir, kindly give me the question in written form. I will write. I will write the correct answer. But don't ask me that question, sir. Whenever I am asked one question, difference between C and C++, his or she is not going to speak a single word. But whenever I write difference between C and C++, she is write 100% correct answer. So what is the perception behind this? So we have different segment of brain, and with different segment of brain, different type of roles and responsibility is going to be depend upon that brain segments. So next slide. So this is the segments more clearly. So planning and decision by frontal lobes and sensory information, then vision, then we have auditory information. If this segment is not properly worked, someone cannot going to speak. So some friends of yours maybe you found in your career from childhood to till now, some of your friends are not going to be properly talk. In between talk, they have to stop. Maybe someone have not proper visualization power. Someone have not properly memorized power. So sometimes we can call it slow learners. What is the meaning of slow learners? So someone can, we are having keep session for slow learners. We have to go for remedial classes. What is the purpose of this in the education system? So we have to keep enhancing the memory power and improve this skill to remember more easier way by different pedagogical teaching. See, in early days teaching only chalk and talk, but now we have different types of teaching platform or infrastructure. We have to show some fruits and tell them, yes, this is the orange, this is the apple. But whenever our traditional teaching, only by showing picture we have to tell them apple and orange. But now which one is very fruitful? To see and real orange and apple and to showcase them, this is the fruits of orange, this is the structure of apple. So it is more clarity or more visualized. So brain is receive more, which one? If we have go for more clarity way to show them the fruits of this is apple, this is orange. Similarly, here also we have to more way of analysis, sense artificial intelligence. So intelligence we have, what is the meaning of intelligence? Can anyone tell? Intelligence.
So like to define artificial intelligence?
Only you have to tell intelligence.
Like how intelligent an individual is, how smart he or she is.
I am not asking individual intelligence. What is the meaning of intelligence? We are using
smartness.
Okay, one and smartness. And any other point of view?
Sir, I guess intelligence are the parameters that are decided in how quick you are in problem solving or how quick you are in answering any response or solving any question or person.
So how intelligence we are going to be form it?
Sir, I guess the standardized method is IQ.
Response to the problem or the situation is front on in us.
So 2 plus 3 equal to 5, all can know. That is we can call it intelligence. Why? Why not? Even as 2 plus 3 equal to 5, some students are not going to go for answering as per some psychology issues. See, if you have brain is going to be healthy, so you have to conscious about what is 2, what is 3. But if one person is not properly conscious with respect to brain, so 2 is what for him or her 2 is something and 3 is something and plus is something. So whenever you can tell 2 plus 3, 2 is one numeric number, 3 is another number, plus is one operator, 2 plus 3 equal to 5. So how it can perform? Some expression should be there. Arithmetic logic unit is going to be processing all these things. So in your brain, 2 plus 3 equal to 5. Similarly, 2 plus 3 equal to 5 in also calculator and also computer system. Computer system also 2 plus 3 equal to 5, and you can also calculate 2 plus 3 equal to 5. So computer have also brain. So computer brain को हम क्या बोलते हैं?
Central processing.
So for whenever we can call it 2 plus 3, what is our central processing?
Brain.
So brain is common in that cases, but for ourselves, brain is our natural and biological system, and for system,
It's a machine.
machine means machine is not machine. System
Potential on how it works.
how computer system is going to be looks like. Computer system, see the computer system is laptop is you are going to be using. What is the laptop? How we can configure laptop? How we can going to be configure one laptop? Combination of hardware and software equipments. So whenever we have one system, what kind we can use? What type of intelligence we are using? Artificial intelligence. So see, you have proper learning techniques. See, now we are come to AI. You have proper learning techniques so that you have tell your answer 2 plus 3 equal to 5. If you are not child education even also. If you are not proper child education, can you tell me 2 plus 3 equal to 5? No. Because you have proper learning from your child education. You have learned addition, subtraction, multiplication, division, everything. And you already know the alphabets, already know the number system, so you can tell easily the calculation system. But how a system can calculate the same answers? We have to create an artificial intelligence. So intelligence is nothing but we have to create something, knowledge, with help of proper reasoning power, with help of proper logic design, with help of some environment, perception, then only we have one device is going to be reaction as per your input. See, if you have lift, lift has just completely machinery part. Understood? Machinery part. So the capacity of lift is 5 passengers or 5 subjects at a time. Let you have 6 subjects. So either lift is going to be move or stop. Stop. So how a lift is going to be stopped? So can anyone tell them in outside? No, 6%, stop it. So by default, he is counting more extra passengers' weight. Weight is one data. As for the logic, already we have set the logic. If the passengers more than 5, stop. If weight more than 1000 kg, stop. If there is a power fluctuation, stop. We have create intelligence. We have designed one intelligent device with help of artificial manner. Similarly, for healthcare also, we have more need of accurate device with help of proper learning. So 2 plus 3 equal to 5, you one time mistake, second time you can correct, there is not a problem. But for patient diagnosis, you have more awareness towards decision. If you are not going to tell that this is the wrong operation and once again you have to take re-operation. We should not go for like this. For a doctor, patient life is important. For that, doctors require a very good report or very good infrastructure, devices. So innovation, with the help of innovation, we have to design devices, and the devices we have to put some intelligence. For example, so how you can know either it is a viral fever, either it is a COVID type fever, either it is a dengue type fever, either it is a typhoid, what is the medication? Different symptoms, different parameters, and different things is decided the different fevers, and accordingly the decision of medical decision is dependent. Similarly, for example, we have different type of analysis parameter we have to use in learning parameters, AI, which helps more accurate way to give patient comfortableness and patient's diagnosis. See, if in early days what happened? Open heart surgery is a very challenging for a doctor. Now, very comfortable treatment. Similarly, for any type of surgery is in a compulsory during the time of 1990s or 2000 era, but now most of the diagnosis is without major surgical things. Surgical is going to be minus, and more we have to imparting the therapy treatment. More we have to go for AI come into the picture to detect the disease very easier way, so that we are going to be accordingly take a recover action. So nowadays NIMHANS is like a institute where mental wellness study is going on. So we have thinking upon how thinking of a perception of a human being we are going to be study. What a mentally challenged subject is need to be react. For example, see, I am very active, my mental wellness is good, so I should take a class of 1.5 hours. After that I should be go for my demonstration like that. So I have a proper time schedule. But if one mental wellness student, how he or she can come for BTech? A physically challenged subject is going to be come for school with help of car, with help of cycle, with help of regular scooty. What type of device or what type of vehicle he or she should be used? See, for partially challenged subject, scooty is okay. With help of stick, somehow he come for parking, and there should be a slope should be there. Why slope should be there? Because of physically challenged subject come also attend class very easier way. So we have to create an infrastructure in an education system. We have a proper slope. If you can think this is your 64, your classroom is going on, how a physically challenged subject come to your classroom? What is infrastructure you have provided? Either lift is one infrastructure, and slope is one infrastructure. Okay, slope is there, no lift in your institute, slope is there. So whenever there is a slope, one student come to sit in a physical challenged handicapped cycle, and one person is going to be assisting him or her from ground floor to 6th floor. Every time, one day he can help. Second day also he can help. Third day help. After 1 month, he never go for help, because every time it's not possible for one friend to every time to carry from ground floor to 6th floor. So for that we have to take a infrastructure, what automation of साइकिल. उसको साइकिल ऐसा बना दिया गया है जो ऑटोमेटिक वे में वो फर्स्ट फ्लोर टू स्लोप में यूज करके 6th फ्लोर तक जा सकते हैं. मतलब पहले जो साइकिल था, one person is going to be compulsory to stay him or her for a physical challenge student to move or from first floor to 6th floor for attending classes. But this can also sometimes difficult. So we have use of artificial concept. With the help of artificial, we have go for some technology so that sensor can help what type of speed is required to move from first floor to 6th floor in the slope. There may be some turning is there. You know, as a physical fitness, mental fitness, what type of turning is required to from first floor to 2nd floor. But for mentally challenged one subject, how he or she can know what type of turning is going to be required so that he will be very safely move from first to second, second to third, third to fourth. So for those kind of disease, we have required properly artificial assistance to the subject. So we have created a lot of application with respect to BCI. Second slide. Second slide. So this is some basic information about BCI. So I have already discussed, so that I am not going to be consume much time. Next. See, this is the subject and patient. This is brain computer interface and device. Device is important. See how you have in daily life to get information from your brain and to decide either shall I do it or not do it. See, whenever your subject teacher suddenly asks one question, what's your reaction? You are not prepared. You are not prepared. Classroom is going on as it is. Suddenly I have put a question. You are going to be, first of all, not going to be comfortable. To being a comfortable and going to be set with question and appear with answer, you have to take some time. So that you have some information. Brain computer interface is the interface between your subject, patient, and with the device. So if you have designed some artificial device, you have to take some brain computer interface and take some information as a signal, and accordingly the device is going to be react. Either the device is shown, the hand is going to be momentum, left, right. See, for example, if as a physical fitness, if I am tell kindly bring my laptop, so how you can bring your laptop? If the laptop bag is there, you have to take the bag in this order. So the position will be this. But if you have this portion of hand is a completely artificial hand. So how you can going to be take decision to carry your laptop bag? See, if this is your original hand, so sensors, brain is going to be, I am instruct you to bring my laptop bag, so you can easily take. With different position, either you can catch in this way, someone can be in this manner, different degree of position of your hand, it is going to be easily open. But if a mentally challenged and you have to keep a, mentally is also okay, your hand is not okay, this portion of the first part of hand is not okay, so how you can move it? So that sense, the direction depend upon the signal, the hand is going to be momentum. So sometimes you have to see the smart cycle for physical challenged people. So whenever they go for in mainstream of road and car is come to in that road, so automatically the signal is comes. So stop sometimes till he is going to be cross the road. So what type of sensor is going to be give signals, and so that the cycle is going to be stopped for a while, and after the cars are going or cross the roads, then after once again the subject is going to be move into that side. So the thing is what we have to importantly know human computer interface, DBI direct brain interface, and TTD thought translation device. The names are quite similar and their activity is also similar. Next. So BCI applications. So we have, see, this is called as sensors. So what about the sensor technology discussed last session in terms of different perception? In our brain computer interface also we have to use some different sensors we have to place it with our brain to record the brain behavior signal in terms of electrodes. And what are the application? Maybe translation by momentum, by brain mapping, maybe some related paralyzed activities if the subject is completely paralysis, and what type of we have give some assistance devices, we have to go for automation of some daily routines. See, come. So the main theory is of collecting brain signal, interpreting them, and outputting commands to a connected machine according to the brain signal received. So how our brain signal is direct to us in daily life, what should we need to do it or not? Similarly, device also requires some signal, and that signal is going to be interpreting and collection some information from the brain. Next. So this is the application. We have some input. See, we are using specs. So what is the use of specs? See, our visualization is not perfect. So whenever I am sitting with the 4th, 5th row, I am not easily to readable the contents. So how should I read as original visualization power? So I want, as per my power, we have to use some specs so that I have to improve my visualization quality. Similarly, here also we have requirement of some replacement, then we have restore, enhance, and supplement and improve. All these are the segmented or implemented with help of one application of your BCI, brain computer interface. What is the job? First of all is signal recording. After that, signal extraction, feature extraction. Then after feature translation, then application. So if I am going to be already mentioned that if I am going to be identify who is excellent, who is average, who is below average or very good, we have to analysis with the different features. Either the attendance, internal performance, mid-sem performance, maybe external performance, then after extracurricular performance, either presentation quality, written performance, everything will be decided once students are being excellent student or outstanding students. So the behavior similar way, we have to be, with the use of BCI, we have improved, enhancing, supplement, replace all these areas where we are going to be till now face some challenging to maintain proper quality of life. See, if there is a, instead of, there is no duplicate system, device setup, so we have to keep the very difficult life for our maintaining daily life. But if there is an artificial lag, the artificial lag behaves similar type of your original lag. May not be same, but similar way we have to behave. So at best, the subject is going to maintain his or her daily life in a smooth way. He or she attend the office, he or attend the school. But if there is completely not replacement of any subject's body part, then you can think what type of challenging you will face in your daily life. So if you are having not proper hearing, we have hearing device. If you have not proper examples. So if you have like any type of eye problems, so we have to replace. So all the things are possible in medical science, in healthcare, with help of proper device. But those devices are more improved with help of learning and training techniques. So learning comes with help of artificial intelligence. We have to feed into the intelligence into the device. So the device is behave or mimic the behavior like a human being. So how we can behave like a human being? Similar way, we are the device also behave like a common subject. For example, in now vehicle, if you are not put your seat belt, after 20 seconds or 30 seconds, the alarm is going to be on. Can anyone tell to alarm is on? 20 seconds ho gaya, ab alarm baja. How he is going to be take away the decision by sensor. When sensor identify that one subject is sit in the front seat of the car, not going to be put it into seat belt. So whenever he pass signal, means one subject is sit, signal pass, seat belt is not put it, signal pass. Accordingly, the device is going to be react, yes, seat belt is open. So alarm is start. So it is also like a sensor technology with the help of artificial way. Similarly, if a paralysis patient requires some water, because every time no one can sit with 24 hours. If in a subject is completely paralysis, it's a very difficult to one can 24 hours monitor with him or her. So what type of infrastructure we have to give so that at least the rest of the family members are going to be do as it is their work, and some things will be going to be through device. For example, if the bed is completely the bed is in a sleeping mode, so the subject is going to want to lift up something. So maybe his hand is what? One hand is momentum, other parts of body is going completely paralysis. So with the help of some device, one presses button in the bed, smart bed, so that the automatically the bed is come to that, and water is there in the nearby table. So water, take it easily, and once again the switch is going to be press it, so that automatically one sleeping mode. So no one can involve. But if the bed is smart bed is not such type of facility, what is the reaction? He should or she should wait till one of his family member come to the room, and going to be 2-3 person going to be help him to sitting position and give some water, and once again they go for help him to sleeping in the stage. So the device helps. In nowadays hospitals have a very good facility with the sleep laboratory and different clinical process, different type of smart mechanism is going to be, smart setup is going to be there, so that patient is not going to be worried, and then family members also not going to worry for some phase of his or her daily lives. Next. So this is the process of how we have to information. See, whenever we have to discuss about brain, so brain information is going to be recorded with help of EEG signal, electroencephalogram signal, and we have to record from the brain by putting some gel. We are not going to be penetrating any like injection, not penetrating like any type of in the skull. We have to put simple gel, we have to put some electrodes and cap, electric cap, we have taken some information through signal. But anyone can read the signal? No. Next. So these are the applications. Next. These are some devices or companies who provide the BCI related devices. I will share the slide so that you will get more clarity and go through those companies' name. Next. So this is, see, we have like electrode caps we are going to be set up with one subject, and with the help of setup we have to identify with the help of their behavior. See, in NFSU there is a very realistic lab is available. If any time you can get opportunity, you visit and to showcase with help of audio sound of a subject, means speech recordings, with help of that also know either the crime is done or not. With the help of facial expression also go for it. With the help of brain mapping also we go for do it analysis. So every time we are going to take help of AI. Next. So non-invasive, semi-invasive and invasive, these are the 3 different techniques to be going for treatment. Next. What's time? 4:50. Okay. 50. Okay. Rest 15 minutes time is there. After that you can showcase. Next. Skip it. Invasive. See, this is the portion where we have to record the EEG signal. So this is the different segments of our brain. So in the first layer, see how in our cake, whenever your birthday cake you have to order it, there are different slices of range of in cake you have found with delicious cream. Similarly, our brain is also different types of layers are there. देखो childhood में हम बहुत टाइम गिर जाते हैं और बहुत सारा एक्सटर्नल चोट होता है, एक्सटर्नल दिमाग के ऊपर एक्सटर्नल चोट होता है, बट वी आर नॉट दैट मच इम्पैक्ट. व्हाई? बिकॉज द अपर लेयर इज वेरी स्ट्रॉन्ग कोटेड. आप बोलते हैं बहुत सारा स्ट्रॉन्ग कोटेड आयरन एल्यूमिनियम फ्रेम्स है, सो इट इज नॉट गोइंग टू बी destroyed with any small cyclone. Similarly, we have also, our brain is so well with help of grace, we have like structure where we are having external source will be very well fabricated with the different mechanism of neurons, nucleus, all the things, biological system, and we have record EEG signals. Next, in upper layer of the brain. Next, so this is the biological system: cell body, nucleus, axon, dendrite, myelin sheath. All these are the our internal brain structure. Next, soma, axon, all these things. You know the basic neural structure of our biological system. Next, 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 next. So the brain already I have discussed, same things here, occipital, frontal. Next. So once again see, frontal lobe is concentrating, planning, motor control, speech. Sometimes we are telling that sir उसका planning बहुत अच्छा है. हम क्यों बोलते उसका planning अच्छा है? सर उसका assumption बहुत ठीक होता है. मैक्सिमम टाइम बोलता है सर इंडिया जीतेगा तो जीत जाता है, वो हारेगा तो वो हार जाता है, वो बोलता है ये टीचर इतना मार्क देंगे, ये टीचर इतना, सभी एजम्पशन उसका ठीक होता है. व्हाई वन सब्जेक्ट एजम्पशन इज मोर करेक्ट टुवर्ड्स करेक्ट विथ द पावर ऑफ द सेगमेंट, द पावर ऑफ द ब्रेन सेगमेंट्स आर मोर शार्प. सर उसका नॉलेज बहुत शार्प है. व्हाई वी आर यूजिंग दिस वर्ड शार्प, और व्हाई वी आर, सर वो बहुत इंटेलिजेंट है, एक बार पढ़ने से आप उसको याद रह जाता है. सी द थिंग्स इज गोइंग टू बी depend upon our brain structure. Next. See, this is very good representation of how functional areas of the brain, motor area, sensory area. See, sensory area. In nearby your standing position, there is a snake. There is a snake. Like light is not there. Some jungles are there. Like in your newly constructed house, unfortunately there is a snake. Some students are standing like that. The meaning is what? Either his sensory power is weak, so that not going to quick visualize on this, so that he or she is not able to take decisions. So we have required proper sensory power so that it will be very easier to understand what's there in our position and what should we do, requirement of decisions. Next. So this is the signal. Whatever the signals we have to record from the brain to monitor the sleep behavior, we have to think upon those readings, gamma, beta, alpha, theta and delta. It is very slow wave. It is called a deep sleep, 0.1 to 3 hertz. Then it is a light sleep, 4 to 7 hertz. 8 to 15 hertz, somehow understanding the surrounding environment, and this is the complete wave. You are now complete wave. What's going on in the surrounding part, you are here. But whenever you can go for sleep, have you know those 8 hours what's thing going on? कभी आपको कभी सोचे हो ये 8 hours में क्या किया हूँ? किसी को पास याद नहीं है. We go for deep sleep, and whenever you can go for deep sleep, you are not even also so something is happening outside, maybe car horn, or maybe trucks are going on nearby your house road, or some dogs are going to be there. They are going to make a noise. Some noise, even also your sleep is not going to be disturbed. Why? Because you are completely go into deep sleep. Once again, from deep sleep you have to go for wake stage. So how you can go for wake stage? Once again, slowly you can come to wake stage, not directly. See, sometimes you have dreaming phase. So when you can go for dreaming phase? Early morning. So maximum times early morning we have to get dreaming phase. Means so early 3 a.m., 4 a.m. and 6 a.m. Within that we go for dreaming. That is called the rapid eye movement sleep stages. That is a stage. That is a stage in our sleep psychology. Wake stage, light sleep, deep sleep, and dreaming stage. The dreaming stage is called the rapid eye movement sleep stages, where our blinking eye is going to be blinking towards wake stage, and towards we are going to be outer surrounding part, something we can slowly towards wake stage. हम धीरे 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 फिर वेक स्टेज को चलते हैं. कभी आप ऑब्जर्व कीजिए, आप जो स्टेज में स्लीपिंग स्टेज में आप पोस्चर था, बॉडी पोस्चर था आपका, उठने के टाइम आपका बॉडी पोस्चर वही टाइम नहीं होता है, because every 90 to 110 minutes our sleep cycle is going to be rotate. Wake to N1, N2, N3 RE. See, for example, today result announced. Today let your semester result announced. Your sleeping time disturbed. 100% your sleeping time disturbed, because if you regularly go for 11 PM, then definitely you go for 2-3 hours late, you go for sleep. Why? Because your mind is under stress that I have not get my satisfactory mark. But if you have got your own achievement or got as per your satisfactory mark, then you have to good sleep. Why you have to good sleep? Because you have feel that I have achieved something. So perception is also important with our surrounding activities, so that several scientists are going to think upon maintain with the social and professional lifestyle. So professional, a lot of stress are there, lot of target is there, social life, your family is there. If you are not balancing, you are not maintaining your quality of life. So for that, we have to require a proper solution, and that solution is going to be help like AI. So AI is not replace any job, AI is not replace to anyone. AI is going to be enhance our work capability, enhancing our improve with related to skill, improve with respect to our decision. See, today ChatGPT, if you can use in a better way, for example, how to write a request letter to DG, to permission of intensive. Early days what happened? You are thinking, what should I write, to DG sir, a lot of things to be minded. Now, you have to just to put it in ChatGPT, simple format of intensive request letter to Vice Chancellor. A very good samples come and you have idea. Yes, in this way you have to write and you have to make it so the brain is going to be also maintaining similar way with the biological body. We have to rest proper to brain, so that brain is more active. अभी आज आप पूरा रात आप वेक जाग के रखो, नेक्स्ट डे आप उसको एनालिसिस करो. You are not feeling good, you are not attention to a classroom, your memory is going to be somehow delayed, you are not properly responding. आपको पूछता होगा आपका friend, but you are not going to give proper answer because you are feeling drowsiness. Your physical is not going to support you. So why such type of things happen? Because your body is not get rest. So if brain is going to be rest, then only you are going to be redirection of every activity in a smooth way. Next. So next. So this is the called as what hypnogram. So this is the wake, REM, light sleep and deep sleep. So whenever there is a one subject is go for sleep, we have to record the information, and those information is going to be annotated by a sleep expert, and those sleep experts data we have to input into a AI model or AI driven system, either the decision is correct or not. Early days what happened? Why the treatment is so delayed? पहले क्या था, for example you have to go for fracture हो गया due to some scooty accident, you have feel some pain in elbow, so you have think 1990s incident, and your parents have got injured, so they go for some medical. What's the job? No scanning machine there, even also scanning is there, very rare visualization, not correct identification, so completely doctor is going to be complete bandage to entire hand. After 21 days, when your parents once again visit to doctor, doctor asks, pain is there? Yes, pain is there. Why? Because not proper decision taken by doctor because of less support of documents or test report. But now If nowadays you go to any such incident happen and you go to suggestion of your doctor, doctor is going to take very good visualization report and find out the where is fracture is happened. Either it is required bandage, simple bandage is also going to be okay, or surgery is required. If surgery is required, surgery and take proper maintenance of your elbow. If not, if medicine is also it is okay and some bandage is also okay, then bandage will be proper in the position. So the thing is what? The proper expertise is come into the help of AI reports. So AI is come to make more sense with the help of decision process. Next. So smartware, all of you know, sleep pattern is going to be discussed, step count, everything you are going to get it with the help of devices. So that is like a wearable device where the body, you are going to be data is coming to the sensor, it is going to be record, and with the help of that, the device is going to be mentioned, it is the step count number, light sleep hour is 6 hours or maybe 3 hours, all this thing is going to be notified. And if you notify reminder also it is going to help you. Now see, early days what happens, sleep 8 condition. There is no timer, nothing is there. You have to disturb your sleep several times and shut down your AC. But nowadays, once you can set your temperature, once you can set your timer and you go for sleep, nothing is going to disturb your sleep. Automatically AC is shut down and you can go for sleep, and early morning you can wake, then AC is going to be shut down mode, switch off mode. But early days AC, no automatic decision power. Similarly, now healthcare devices also we go for automation with the help of doctor, with the help of doctor's interpretation. So we have help to system, medical system, clinical system. AI is going to help to clinical system. Infrastructure give to AI is help to infrastructure. आपके पास infrastructure है. This is the infrastructure. If this is a smart classroom, so automatically we go for attendance. No need to call roll number one by one. If there is a smart boardroom, automatically erase whatever content I have written, erase it after my class. If this is a smart classroom, automatic the lights and fan is on with the help of sitting arrangement. That is automation. So similarly, our target is automation with the help of infrastructure, with the help of sensor technology, with the help of AI. Next. So these are the different waveforms, delta waveforms, all these things. So we should not go for takes more time. So now all these things, okay, come to the last. Okay, this is the time domain feature. Next. So whatever the code is here going to be showcased by our students, that slides are there. स्लाइड्स पहले दिखा देते हैं, उसके बाद कोड। तो यहाँ पे हम लोग जो कोड किए हैं, स्लीप स्टेज क्लासिफिकेशन, ऑटोमेटिक स्लीप स्टेज क्लासिफिकेशन, स्कोरिंग सिस्टम विद मल्टी फ्यूजन फीचर यूजिंग ML टेक्निक्स। मल्टी फ्यूजन, सी फॉर एग्जांपल द फर्स्ट प्राइमरी टेस्ट फॉर एनी टाइप ऑफ स्लीप डिसऑर्डर इज स्लीप स्टेज क्लासिफिकेशन। आपका जो फर्स्ट कोई भी फीवर होता है, आपका फर्स्ट ट्रीटमेंट क्या होता है? ब्लड सैंपल कलेक्शन। ब्लड सैंपल के पास पता चलता है आपका डेंगू हुआ है, तो डेंगू का ट्रीटमेंट शुरू होता है। इफ वायरल फीवर का सिम्टम है तो उसका ट्रीटमेंट शुरू होता है। सिमिलरली फॉर एनी टाइप ऑफ न्यूरोलॉजिकल स्लीप रिलेटेड डिसऑर्डर्स, द फर्स्ट स्टेप इज स्लीप स्टेज क्लासिफिकेशन। बेसिकली वी हैव 5 स्लीप स्टेजेस एज पर अमेरिकन एकेडमिक स्लीप मेडिसिन ASM स्टैंडर्ड, where N1, N2, N3 and REM. N1, N2 considers a light sleep, N3 considers a deep sleep, REM is behavior same with N1. So the challenging is what? For doctor, the challenging is what? Classify between N1 and REM. मतलब as accurate as feature similar behavior find from N1 and REM, but system can going to be accurate decision because we have biasness. For example, if my own some relatives go for some biasness is going to be from my side. Either I will favor him during Viva, something is there. Either any whatever the personalities you have, something is bias is going to be included if you have own some concept come as per biological system. But for computer किसी का नहीं है, डिवाइस किसी का भी नहीं है। डिवाइस के लिए ऑल इनपुट इज सेम, मतलब जो भी इनपुट देगा इनपुट के हिसाब से आपको मार्क मिलेगा। फॉर एग्जांपल If there is a manual correction, whenever you go for manual correction, see, one handwritten is most neat and clean, written by one student. I have means answer is wrong, but the written style is presentation style is very good. So something inclination from the teacher, at least 1 mark extra for the student, even also wrong answer. It is general perception. Out of 100 subject teacher, 90 subject teacher case, maybe some bias mark is going